Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd Learning Experience. No monitoring system should be used as the sole basis for diagnosis or therapy, and they are intended as an adjunct in patient assessment. Reliance on a single monitoring system alone for patient management is not recommended. The contents and conclusions of the following programs are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidian LP, a Medtronic company, for this speaking engagement. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. For this segment of the series, a discussion on patient safety and procedural sedation. Are distractions and interruptions a concern? To help answer this question are CRNA Brian Berry and sedation nurse Linda Erfle.
Hi, Linda. I hope you're doing well today.
I am. Thank you.
Great. I want to talk a little bit about distractions and alarm fatigue with you. I want to ask you, distractions and alarm fatigue can have serious implications for patient safety. Linda, what is alarm fatigue and how do you define it?
Okay. Well, alarm fatigue is a phenomenon that occurs in the healthcare setting when there are numerous monitoring devices. And I've been a nurse for a long time, almost 35 years. I've worked in the ER, the ICU, the procedure room for the last 10 years. And the sheer volume and noise of the alarms can be very overwhelming. And, I think I'm a diligent nurse, but once you are used to the alarms, you become desensitized. It's real. So no matter how good you are, there is alarm fatigue and it can lead to adverse events. Brian, can you talk about the SARA alarm system and Smart BDA and how you use it in your clinical practice?
Yeah, absolutely. What Sarah and Smart BDA do, and they stand for the Smart Alarm for Respiratory Analysis and Smart Breath Detection systems, they're all centered around what we're talking about today, alarm fatigue and decreasing all those non-important alarms. And what we found is in studies have confirmed is there's a substantial decrease in those what we consider non-critical alarms. So those practitioners, those clinicians that are finishing up a 12-hour shift aren't constantly silencing an alarm that actually is important. So these algorithms, these very smart, sophisticated algorithms actually decrease non-essential alarms. So they're very great, and I think they make us more effective clinicians and providers. I also want to talk about the integrated pulmonary index system. It's also a smart system, an algorithmic system that take the heart rate, the pulse ox, the end tidal CO2, and the respiratory rate, and take these 4 numbers, send them into an algorithm, and you see a numeric value from 0 to 10 on how well your patient's breathing. Another system that really helps us as providers and clinicians to know when it's important to intervene in patients that are being affected from a respiratory standpoint.
Wow, Brian, it's so interesting. It would be great if everyone had access to this monitoring to reduce alarm fatigue.
Absolutely. All right, Linda, let's finish it up with distractions. So we've talked a little bit about alarm fatigue. Now let's talk about distractions in the procedural room. Tell us your thoughts on that topic.
Distractions. They're serious, and anything could be a distraction. Not only the alarms that we were just talking about, but music, the conversation during our procedures, the temperature of the room. I'm hot, she's cold. CRNA was definitely cold yesterday because I was going to pass out from the heat that she had on. These are the real distractions, and it just makes sense that when there are more distractions, clinical and medications occur. Here's the facts here on the slide. After 4 distractions compared to 1, nurses made 2 times more clinical errors and had 20% more procedural failures. Another example over on the other part of the slide is an exposure to distractions and interruptions. Residents using a virtual reality trainer were 7 times more likely to make major surgical errors and 2.6 times more likely to forget to perform a prospective memory task. So I can give you an example from last week that just happened to us. We were doing an EGD on a patient with bad teeth. Some of the teeth were loose, but we had to do the procedure. So we used a soft, nice bite block, but still the front tooth fell out. It's in the mouth during the procedure. I grabbed the tooth. We were able to get the tooth out, and that procedure went well. But it became our distraction, one of our distractions. We talked about it for the next 2 cases. And then on that 3rd case, we had a respiratory depression. We had to pull out the bag. And, we're not sure, but, according to the slide here, the more distractions, the more complications you're going to have.
Excellent information.
That's all I've got.
Thank you so much.
Thank you.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.